Good day, I'm Marfen Estrada, second year medical student of Manila Central University, and today I'm gonna be discussing about immunization and how to properly inject the vaccine. So after doing hand washing and preparing all your materials, introduce yourself to the patient or to the relative and confirm his or her identity by asking the parent or the relative or the client itself for his or her name. Then identify if it is the right time for the vaccination, if it is the right schedule, then identify the right vaccine. For intramuscular vaccine, we have DTaP, IPV, and Hib. So intramuscularly, in preparing, we use sterile water for diluent, assuming that it is powdered form. Okay, aspirate the diluent, incorporate it to the powdered form vaccine, confirming the expiration date and the name. Mix it well, then re-aspirate it. The proper dosage is 0.5 ml. You have to consider to know the proper dosage. The proper site and the proper route of administration is IM. So the proper site for the pediatrician 1-year-old, it is the vastus lateralis for IM. Use separate new needle for it not to be blunt. And then disinfect the site, inner to outer circular motion. Pinch it slightly like this, and then 90 degrees. Aspirate for blood if there's none, continue. Then put dry cotton ball, applying pressure on it, and putting here, like pressure on it. Next, for the subcutaneous vaccine, we have the MMR. In preparing, also likewise, sterile water, aspirate, then mix it well with the vaccine, assuming that it is powdered form. But there are MMR that is not, there are MMR that it is not powdered form. So re-aspirate it. So after re-aspirating, use separate new needle for it not to be blunt, especially for the pedia patient. So we use separate new needle for it. Then usually it is still the subcutaneous tissue of the thigh or the upper outer quadrant of the triceps area. Clean, circular inner to outer circularly, pinch slightly, 45 degrees, inject to the subcutaneous fat. You don't have to aspirate. And then continue to injecting. Then put dry cotton balls and apply a slight pressure, and then apply plaster.